passive physiological intervertebral motion testing can be performed in side lying. Now, we can use the lower limbs to generate the passive movement in the lumbar spine. So, you need to support the weight of the lower limbs using your hand under the shins like this, and you can place their knees against your thigh. So then, it'll be quite easy to generate that movement, flexion in this case, in the spine. So once you're happy with the setup, you then identify the segment which you need to palpate. So in this case, we'll start off at L5-S1 and work our way up the spine. So it's important to feel motion segment movement to palpate two adjacent spinous processes and the intervening interspinous space. So in this case, I'm palpating with my left hand the spinous process of S1 and L5 and the interspinous space. So then I'll generate the passive movement. And once I appreciate movement of S1 under my fingers, that signifies the commencement of segmental movement in flexion. Once I feel movement of L5, that signifies the end of the segmental movement in flexion. So palpate a few times so you can determine whether the segmental movement is normal, hypomobile, or hypermobile. And once you're happy with that, you can move up to the next level. So you're palpating L4-5, and then up to the next level onto L3-4, and so on up the spine. And you'll appreciate that the further up the spine you go, the greater you'll have to take the hips into flexion. A similar procedure can be used for extension, except this time we're going to extend the lower limbs. So once again, support the weight of the lower limbs, like so. Identify and palpate the level you're testing, and then bring the lower limbs into extension to generate the passive movement. So once again, once I feel S1 move under my fingers, that's the start of the extension movement for this level. And once I feel L5 move under my fingers, that's the end movement for this level. So again, palpate a few times to determine whether it's normal, hypomobile, or hypermobile. And then move up to the next level, L4-5, and then up to L3-4, L2-3, and so on, up to T11 or T12. And you'll appreciate once again that the further you go up the spine, the greater you've got to take the lower limbs into extension. The next one we can test is side flexion. Passive physiological intervertebral motion testing of side flexion. With the others, you're palpating adjacent spinous processes and the intervening spinous space. But, for example, in this position, we're creating a left side flexion movement. So you'll appreciate that with the left side flexion, we get an opening or a stretching on the right side and a closing and or compression on the left side. So I can palpate on the lower aspect here of the spinous processes to try and pick up on that opening movement, or I may prefer to palpate above to pick up on that closing type of movement. We can then test rotation physiological movement. We'll tend to do this from the top down. So once you've found T12L1, palpate both spinous processes and the interspinous space as before, and then using the trunk, we're going to generate a rotational movement, like so. So lean over so that you can observe what's happening, and then create the rotation movement, appreciating what you're feeling under your fingers so you can decide whether the movement is normal. Move down to the next level, and the next level, and so on till you get down to L5-S1. Another test that can be performed in this position is the shear test, a stability test for the lumbar spine. So it's similar in application. Once again, I want to support the weight of the lower limbs using my hand and my thigh against his knees. Now I'm going to generate an anteroposterior force through his thighs to move the sacrum in an anterior-posterior direction on the lumbar spine. So once again, this is the setup. Support the legs with my hand and my thighs. I need to come in and palpate what's happening at the lumbar spine around L5 and also at the sacrum via S1. And then I'm going to generate the AP force using my thigh. So in this direction, I'm now working him forward like this and palpating for any movement. Now there will be a small little bit of movement in the normal spine, but excess movement in an anteroposterior direction is an indication of instability. And this is how the test is done.